So welcome to our introductory webinar on Smilefast, which we titled Comprehensive Orthodontic Training for Short-Term Orthodontics. Most of you probably don't know me, but I'm Dr. Geoff Hall. I'm a specialist orthodontist here in Melbourne, Australia. I graduated from dentistry back in 1983 at the University of Melbourne, and I did my orthodontic training back in the United States of America at the University of Pennsylvania between 1988 and 1990, where I came top of my class. And I say that not because of any arrogance whatsoever, because if you notice, I haven't told you where I came in my undergraduate dental degree in 1983, which is probably 49 out of 50. And the point that I'm trying to make out of all of this is that anybody can do orthodontics. Once you understand the principles, it is very, very straightforward. And for too long, people have kept orthodontics as a very closed shop. But it is actually very easy once you understand good, sound principles. Back in 2005 to 2010, I was awarded the Diplomate of the American Board of Orthodontics, which is the highest honour that we have in orthodontics for a private practitioner. I've been involved in many different study clubs. I founded the Australasian Lingual Orthodontic Study Club, the very prestigious Australasian Orthodontic Study Club, member of all these different societies of the Orthodontics, American Society of Orthodontists, the Australian Society of Orthodontists. I brought the Seattle Study Club to Australia. I brought the New Horizons Study Club to Australia. And I was also the first person outside of America to be doing Invisalign. So in fact, I brought Invisalign to the Southern Hemisphere. So that's me as a specialist orthodontist. But what tonight's all about is it's about Smilefast and what I call cosmetic orthodontics. So what we're going to discuss tonight is what is Smilefast? Why do you need Smilefast in your practice? What are the benefits of Smilefast to your patients? What are the benefits of Smilefast to your practice? And then a question that I get asked very often is, why is Smilefast superior to other systems that I see advertised? And then we're going to talk about the Smilefast PRO course, which is our 2-day intensive training course. So, first question is, what is Smilefast? And Smilefast is the most efficient and predictable cosmetic orthodontic solution. It provides patients with significant improvements in dental alignment in a very short period of time. And Smilefast allows for a cosmetic correction of the front teeth without occlusal damage. So in essence, we're not trying to change the posterior occlusion. What we're trying to do is cosmetically align the front teeth. And our goal, therefore, in Smilefast is not to achieve a perfect skeletal or occlusal relationship, but a great smile, a great natural smile in a short period of time. It's faster and more affordable than other treatments, and that means more patients, because what patients want is speed and cost effectiveness. And the question is, why do you need Smilefast in your practice? And I think most practices, if I'm not mistaken, are no longer booked up 6 or 9 months ahead for new patients as we were 30 or 40 years ago. And most of our practices could find vacancies this week or even tomorrow in some practices. So what we want to do is find more patients, and not only find more patients, but probably more importantly, find the right patients. And to do that, we need to give patients what they want. Very few patients come into you and say, "Doctor, could I please have a root filling on an upper right second molar tooth?" That's not what they come in for. That's not what they want. They might need it, but that's not what they want. So patients want straight teeth and a beautiful smile. That's what they're all after. So we want to give patients what they want, straight teeth and a beautiful smile. And this gets back to the point of patient's needs or patient's wants. We as dental practitioners know that every patient needs healthy, functioning teeth. But what they really want is straight teeth and a beautiful smile. And what Smilefast does, it meets this demand and will build your practice. And it will build your practice in a very profitable way. And with Smilefast, it's a technique which usually takes about 6 to 9 months. It's a procedure that patients want, and we all know in our experience, patients will always find a way to pay for what they want. Have you ever had a patient come into you and they've said they can't afford your dental treatment, but they've just bought the latest iPhone 6 for $900, but they can't afford your dental treatment for $200? Or have you ever had patients cancel their appointments with you because they can't afford their treatment because they're going overseas for a holiday? Patients will always find a way to pay for what they want. We as dentists, as consumers, also will always find a way to pay for what we want. And what we want to do basically is to drive more cosmetically oriented patients through your practice, because we know that these are the best type of patients to have. And what this will do is going to dramatically increase your new patient flow. Obviously your orthodontic starts, and most of you probably don't have many orthodontic patients. As a byproduct, it's also going to increase your general dental procedures, be it amalgams, fillings, etc., cleans. But more importantly, we are driving cosmetically oriented patients into your practice. And as a result, you're going to have an increase in the cosmetic dentistry procedures, such as bleaching, whitening, veneers, the procedures that patients want to have their straight and white teeth, and the procedures which are also very profitable to you, and the procedures which also give you greater satisfaction in dentistry. So at the end of the day, what we want is to build your business. So we're going to drive more cosmetically oriented patients into your practice. My aim and my suggestion to you is this will help to reduce, and you can delegate your unprofitable procedures, because at the end of the day, you only have so many hours in a week and so many hands that you can work with. So if we can delegate these unprofitable procedures to our assistant dentist, to our hygienist, and for you to be doing the high-end profitable work, that'll be far more interesting for you, far more enjoyable, and obviously the bottom line, far more profitable. In Smilefast, we can actually delegate 95% of our procedures to our hygienist or our dental therapist or a young assistant dentist. The procedures are straightforward and very mechanical. And in fact, in our Smilefast courses, we actually offer to train the hygienists and the general dentists. We actually offer to train the hygienist and the therapist as part of the course. You're going to increase your hourly profitability, as I'm going to show you later. You're going to increase your gross and net income. And at the end of the day, I want you to achieve greater dental satisfaction, because those of you who are a little bit older like myself realize that it's hard to maintain satisfaction in dentistry with doing the same class 2 cavity preps, same amalgam fillings, same crowns. And what's probably most important, if we're going to be competitive in today's market, is for you to have the ability to differentiate your practice. You must be different to the person down the road. Otherwise, why is a patient going to choose your practice compared to somebody else's? And differentiation, I think, is a key word. And Smilefast offers a form of differentiation for your practice. And I think, Adam? My screen's just frozen for some reason. Okay, thank you. Okay, Smilefast is the treatment patients want and the benefits that you're looking for. It's a complete system from first contact to fee presentation, starting from including bracket placement, our monthly adjustment visits, our D-band, which is the removal of braces, and finally the retention aspect. And we will teach you the complete system. What I teach is Smilefast is purely for adults and primarily for cosmetic treatment. And I say that because as an adult, we want to make sure that, let me rephrase that. When we deal with children, a child who has a class 2 malocclusion with a severe overjet, we would like to provide them with an ideal class 1 occlusion, optum overbite, optum overjet, and a mutually protected occlusion with canine guidance. Why? Because we don't know if the malocclusion will cause them problems in the future, whether it be grinding, wearing away of teeth, TMJ problems, etc. On the other hand, adults come into us and they've got a class 2 division 1 malocclusion, the same problem that I just mentioned before, but they've got no dental problems. They've got no TMJ issues, no wearing away of teeth, etc. We can then quite safely say we can align the anterior teeth, and if we don't change the posterior occlusion, we will do no harm for that patient. Now, bearing in mind all of the principles that we talk about in Smilefast are as appropriate for children as they are for adults. However, for the adolescent patient, I'm a big believer that we must treat them to an ideal occlusion. I'm also a big believer that every adult patient should be given the option of ideal treatment as well. But as you're going to see later, very few adult patients actually want ideal treatment. All they're after is a good cosmetic result. Because there are barriers to adult treatment, and I'm sure that each and every one of you have referred patients to an orthodontist and they've gone back to you and said they don't want orthodontic treatment. And the main reasons these adult patients do not want to undergo the conventional 2 years of orthodontic therapy is time, cost, and appearance. They don't want to spend 2 years in braces, they don't want the cost of braces, and they don't want the traditional metal braces. Add on to that extractions and orthodontic surgery, and very few adults actually want to undergo orthodontic treatment with an orthodontic specialist looking at the ideal orthodontic result. They don't want to do that. Very few want to do that. They're the barriers. So what Smilefast is designed to do is to remove the barriers. We want to reduce the time, we want to reduce the cost, and we want to improve the appearance compared to traditional orthodontic therapy. And when you compare Smilefast to aligner therapy, the problem with aligner therapy is the speed. It's a very slow process. There's an online portal, but there's very little ongoing support for you to know what to do if things go wrong on a visit-by-visit basis. And we will demonstrate later how much more profitable Smilefast is compared to aligner therapy. And you've got to remember, I was the one who brought Invisalign to Australia back in 1999, and I've been involved directly and indirectly in over 1,000 Invisalign cases. So I have a lot of experience in the Invisalign aligner area. So when you want to compare Smilefast to veneers, obviously veneers are very quick, they're very accurate, but once again, the support that you have on a case-by-case basis is not that great. You make a good profit out of veneers, but I will argue with you, you can make more profit out of Smilefast, especially if we delegate, you'll make a lot more profit out of Smilefast. So in other words, Smilefast will be in your high-end profitability area. But the problem with veneers, as we know, it's a very destructive process. And in today's society and dentistry today, we want to look at minimally invasive dentistry, and veneers don't do that. So the patient's concerns with these other cosmetic treatments, in essence, the aligners take too long, there are too many visits, they're too expensive, and there are many unpredictable movements. To do extrusions with aligners, to rotate curved teeth is very difficult. To tip teeth is very difficult. Veneers are very invasive from a dental tooth structure point of view. They're costly and they're not permanent because they have to be replaced every 10 years or so. We all know with traditional braces treatment, they lack digital accuracy and they're too long in treatment. And then we've got bonded composite, which is not natural, it's not permanent, and it discolors as well. So let's go back to the barriers to adult orthodontic treatment. We have time, we have cost, appearance, extractions, and surgery. But the three main ones are time, cost, and appearance. So with our Smilefast approach, we usually finish the treatment between 6 to 9 months. The cost of Smilefast is usually at least 25 to 40% cheaper than what you might be charging for aligners or traditional orthodontic therapy. And appearance, we use clear aesthetic brackets on both the upper and lower arches. And I'm granted, it may not be as aesthetic as Invisalign. And then people say to me, no, patients want Invisalign instead of braces. Well, that's not true. That is not true at all. We did a survey of 500 adult patients who accepted orthodontic treatment in our practice over the last 3 years. And you've got to understand that in our practice, we offered every patient the ideal option, be it 2 years of braces, whether they needed surgery, extractions, whatever was the ideal option for that patient. We offered them Smilefast if they were an acceptable candidate, and in my hands, probably 90% are acceptable candidates for Smilefast. And we offered them Invisalign, every patient. And out of the 500 adult patients who started treatment, who accepted orthodontic treatment, 90% chose Smilefast, 5% chose aligner treatment, and 5% chose the ideal approach, whatever that was. And the biggest factor was time. The biggest factor was time. And I believe now there is a psychological barrier which says if you can do the treatment within 12 months, people will go ahead and have it done. Also, cost, the fact that Smilefast was a cheaper and more cost-effective alternative to the other options, that was also a benefit. And most patients can live with clear braces for 9 months. Don't ask them to live with it for 2 years, but they will live with it for 9 months. So time is without doubt the biggest factor. And then the fact is that with Smilefast, with the clear braces, you can do far more predictable movements than you can with Smilefast. It's a very easy approach. And as far as I'm concerned, you must be offering cosmetic orthodontics today. If you want to be competitive in today's market, you have no choice. The keys to orthodontic treatment, if you asked any orthodontist, they would say to you, firstly, it's the diagnosis, which cases to treat and which not to treat. And through our Smilefast program, which we're going to talk about in a bit more detail later on in this webinar, we will show you which cases to treat, but we also have an online portal to make sure that you only treat those cases which are appropriate and are simple to treat, what I call the low-lying fruit. But the second key is once you've made the correct diagnosis, it's how we put the braces on the teeth. And there's nothing magical about it, except it takes a lot of experience normally. We've actually broken that down into a very simple approach by using indirect bonding, but more importantly, by using our patented, unique digital indirect bonding software, which can position the brackets in the right position, and you can see exactly where the brackets are going to be positioned, but more importantly, what the end result of that's going to be. Not too dissimilar to an Invisalign ClinCheck. And we are the only system that uses this unique digital indirect bonding system. And then once we've placed the brackets, we just have to teach you the basic mechanics of adjusting arch wires, etc., etc. And that's part of what we teach you in the course, but we follow it up with consistent and quality online support. And there's an 80-20 rule. No different to everything we do in dentistry. You can treat 80% of the patients very easily. It's knowing which 20% not to treat. And that's what we're going to teach you in our course. And once again, on an ongoing basis, when you submit cases to us, we will make sure that we're only treating those patients which are going to be the 80%. They're going to be treated very easily. They'll be very profitable for you, and there'll be absolutely little or no issues at all. And that's going to be through our comprehensive orthodontic training and our online case submission portal. So this gives you a demonstration of our digital indirect bonding. Now remember, these are just purely screenshots. Our digital indirect bonding viewer is a three-dimensional viewer, so you can manipulate these 3D models and see them in every different dimension. But this shows where the brackets would be positioned in the maloccluded position. And then what we're going to see is this will be the end result based on our straight wires being placed with the brackets in this position initially. So as the teeth line up, this is how we would envisage the end result to be. So all we've got to do then is then teach you how to use the mechanics. So these brackets are placed in an indirect bonding tray, which we'll see later on. It's like a bleaching tray, and all you've got to do is etch and bond and put a little bit of composite on it and hold the tray in, and voila, the brackets will be in the right position on those teeth. And this is the key to success, is we're utilizing this digital indirect bonding system to ensure the brackets are placed in the right position. And you can show this digital setup to your patients as well for them to understand what the anticipated end result's going to be. And this is a 3D viewer, so you can manipulate this model in all dimensions. Let's show you cases that can be treated routinely after you attend a 2-day Smilefast PRO course. Now, I want you to look at each and every patient or each and every case and say to yourself, how would I treat this case if I couldn't use cosmetic orthodontics? How could I treat this case in purely a restorative manner? And then ask yourself, would I do that to one of my family members, one of my good friends? Is it biologically and ethically correct to destroy that tooth structure to that degree to get a cosmetic result? When you've got the option of cosmetic orthodontics, that in 6 months we can align these teeth. Yes, you're still going to need a little bit of a veneer, a little bit of composite on the incisal edges here because of the wear, but that's all the finishing touches for this patient. This patient here with a Class 2 Division 2 malocclusion, how would you restore this patient without devitalizing that upper right lateral or building out the upper incisors to such a thickness with veneers, when you can do that in 6 months with our cosmetic Smilefast approach? Rotated upper incisors, done in 5 months. Patients who've got uneven gingival margins due to excessive extrusion of teeth due to compensatory wear. And we can intrude the teeth to level the gingival margin and then restoratively build up the incisal edge. And that can be done in 6 to 9 months. This patient took 8. Patients with spacing can take 5 months. And obviously the greater the spaces, it can take longer. But this gives you an idea of what we can achieve. How would you build this tooth up with veneers? You can imagine how wide you would make that veneer. Can you imagine how much tooth structure you'd have to remove from the distal aspect of that tooth? And one of the great advantages of Smilefast is we can do one arch treatment cost effectively. So here we just did the upper arch only, and we were able to position the upper left central incisor a little bit more lingual, so no reduction would need to be made on that tooth for a further placement of a veneer on the labial aspect. This patient actually had a veneer initially, and it was so thick to try and line it with the upper right central, the patient didn't like it. So now a very conservative laminate veneer can be made for that 2-1. What about here in the lower arch? And we're finding a lot of adult patients now coming in, I should rephrase that, a lot of older adult patients coming in for issues cosmetically of the lower anterior teeth. because there's this fallacy that people are only concerned about the upper teeth. As one grows older, the lower lip drops and you start to see more of the lower teeth. So we're seeing a lot of more elderly people in their 50s, 60s, and even 70s coming in because aesthetically the lower teeth are crowded and they don't like the appearance when they smile, because that's all they're seeing is the lower teeth. So we can fix this in 8 months. And anyone can do this. 9 months of treatment. Yes, a bit more difficult case, but a great result cosmetically. Severe lower crowding. 7 months of treatment. And I can assure you that after a 2-day course, you will be able to do this yourself. Crowding of the upper and lower teeth. 9 months of treatment. Patients ecstatic. Patients driving in more and more patients into your particular practice. Significant spacing in the upper arch. Very uncosmetic. In 7 months of treatment. Severe crowding in 10 months of treatment, and that's pretty severe crowding. So at the end of the day, what are the benefits of Smilefast to your practice? Because you can see the great benefits to the patient. It's the profitability of Smilefast, firstly, and profitability is not a dirty word. Everybody deserves to make an adequate profit. We are never going to be multi-millionaires out of general dentistry. But I do believe that every dentist is entitled to making a good living for the amount of work, the amount of study, for the amount of stress that we go through on a day-to-day basis. We are entitled to an acceptable hourly rate and to an acceptable profit, and doing the right ethical thing by our patients. So in an average Smilefast case, it's about 5.5 hours of total chairside time. Usually we allocate about 1.5 hours for the banding, about 1 hour for the debonding appointment, which is the removal of braces, and about 6 adjustment visits of 30 minutes each. So total of about 5.5 hours. That's bearing in mind that you as the dentist is doing all of this. So it's 5.5 hours of total chairside time. However, we're looking at 7 to 10 patient appointments, and out of that chairside time, it's really only 1 hour of doctor time. In other words, if you have a hygienist or an auxiliary there, you can delegate all the remaining part. So it's only a maximum of 1 hour of time that's required by the dentist. And here it says 3 to 5 hours of chairside time. The reason being is obviously if we're doing a one arch treatment, either the upper arch or just the lower arch, the chairside time is less than it is if you're doing 2 arches. And we've got 6 to 9 months average treatment time. So let's say you charge a fee of $6,500, because you have to remember we are using clear braces on the upper and the lower teeth. Now, most Invisalign cases, I would imagine you're charging about $8,500. And if you went to an orthodontist who was doing clear braces on the upper and lower teeth, which is quite unusual, I might add, but if you were, that fee would probably be somewhere, depending on the city. In Melbourne, it would be about $8,500. In Sydney, it could be anywhere up to $10,000 or $11,000. So let's say we charge a fee of $6,500. Our Smilefast fee, which includes the digital indirect bonding, the digital setup, the brackets which are in the bonding tray, and then we have what we call an arch wire or a Smilefast arch kit, which provides all the arch wires that you need. It provides you with the elastics, the ligatures, all the little miscellaneous products. That cost for 2 arches is $1,299. And so I've made it $1,500, so that way it would include the retainers as well. So your total costs for a 2-arch kit for a 2-arch patient is about $1,500. So let's say you charge $6,500, your profit is $5,000, and if you divide that by your 5.5 hours, that's an hourly rate of nearly $1,200 per hour. That's a good hourly rate. If you take away your costs of $5,000, that's an hourly rate of $900 per hour after your lab bills. And I would argue with you that you're not making that much with your veneers after your lab bills for the veneers. So we are in the high-end hourly rate. Now, bearing in mind That's if you as the dentist is doing all of this. You can delegate 4.5 hours of this work. You should only have to do 1 hour. And so you could be doing a crown prep in one room and the hygienist could be doing the rest in the other room. And once again, we will train the hygienist. And you're going to say to me, but Geoff, I think $6,500 is too much. Okay, that's fine. Let's say it was $5,000 that you would charge. And if you did it on your $5,000 figure, you're about $900 per hour. If you do it on your $5,000 gross figure, that's $3,500 after your lab fees, etc. That would put you to about $650 per hour. Now, once again, a $650 per hour rate is your high-end rate after your lab fees. So whatever way you look at it, it is a very profitable procedure. And once again, that's if you're doing it all. If you've got a hygienist in there, you can make this into a very profitable part of your practice. So when we compare the profitability of Smilefast compared to aligners, and I've done a survey in my practice, Smilefast was quite profitable and aligners were about $625 an hour. But what was really interesting was when we take out the lab fees, because the lab fees for aligners in particular, like Invisalign, is about $3,000 to $3,200. It depends on the volume that you're doing, and obviously you will get discounts, but your lab fee will be always higher with Invisalign. The profit per hour when you do an aligner case is about 1/3 of the profit that you're going to get from a Smilefast case, which is very interesting. So your Smilefast is much quicker, the patients like it more from that point of view, and the predictability of the results is far better. And then you're going to say to me, well, how much profit can I make? Well, we figured out that if you do 2 cases a month of Smilefast, you will earn an extra $7,000 a month profit. So not gross, profit. That's after you've taken away all your expenses. So that's another roughly $85,000 per year profit. That's a lot of profit. From what I understand, most dentists make about $250,000 profit. So that's about a 30% increase. And then you can say to me, Geoff, but how can I find the time to do that? Well, basically, if you want to do the 2 bandings a month, you need to find 14 hours a month. And assuming you work 14 days a month, that's 1 hour per day of time. But out of that 14 hours per month, you need only 4 hours of doctor time, 10 hours of your hygienist time. So can I ask you, could you find 4 extra hours a month of your time and your hygienist 10 extra hours a month, which is probably about half an hour a day, to make an extra $80,000 or $90,000 per annum profit? And then if you want to go to the level of making an extra $250,000 profit per year, you can do 6 patients a month, 12 hours of your time a month. So find me 1 hour a day of your time and 30 hours a month of a hygienist. That's the equivalent only of 1 day per week of a hygienist. So you can really increase your bottom line significantly with this approach. So what we want to do is drive more cosmetically oriented patients to your practice. We want you to reduce the unprofitable procedures. We want you to delegate the unprofitable procedures. I want you to delegate, or you're allowed to delegate 95% of Smilefast procedures. It will increase your hourly profitability. It will increase your gross and net income. You'll achieve greater dental satisfaction. And I think that's a very important part of all of this. Remember, short-term cosmetic orthodontics is not a replacement for comprehensive orthodontics. Every patient, I believe, should be provided with the ideal orthodontic option. It's up to the patients to decide on their treatment plan. We just have to give them the different options. Trust me, 90% of adult patients will choose Smilefast over Invisalign, aligners, or full-on orthodontic treatment, embracing the traditional 2 years of metal braces. But in Smilefast, you're going to pick the low-lying fruit. You're going to pick the straightforward cases, and trust me, there are a lot of straightforward cases. And it's designed for adults, not for children. However, everything we teach you in Smilefast, the principles remain the same. And if you're not sure, we tell you, refer the patient or ask for advice. So let's show you a case. You saw a little bit of her before. So this girl comes in, lovely girl, and she wants a better smile. She's got a class 2 skeletal pattern, as you can see, and we're going to teach you all about taking photographs and good records. She's got a class 2 buccal relationship with a division 2 appearance with her upper incisors retrocline. She went to see 4 orthodontists before she saw me. 2 said we're going to do orthodontic surgery. The other 2 said we're going to extract teeth. And she didn't want any of that. I said to her, I can do Smilefast for you. I can purely align the teeth. Yes, I'll leave you with a bit of overjet, but I will give you cosmetic alignment. Because her other option was to have veneers on her upper anterior teeth. And can you imagine how thick you would build out those veneers? Can you imagine how much destruction on those upper canines? So she went with Smilefast. So we take our Smilefast records and we use a lateral cephalometric radiograph, an OPG. We do a Ceph analysis, and we are the only system that I know of that utilizes a cephalometric analysis to aid in our diagnosis. And I think that's essential from a medico-legal point of view, because without that, I think you're indefensible. You'll have an orthodontist who say you needed the lateral ceph. Well, we go through that with you as well. So then we have the 3D viewer. Because we made the diagnosis, we're now going to put the brackets on, and we use our 3D viewer to identify the correct bracket positioning. And this is all done for you with Smilefast. All you need to do is do the final approval of the case. And why do you need to do the final approval of the case? Because no different to Invisalign, it's a medico-legal point situation. But for example, you might be wanting to intrude this upper left central incisor to do a veneer on it. So all you would do is say to me, could you please intrude that tooth? We will intrude it to the right level, and only once you're happy with it do you go ahead and press the approve button. So in essence, you've got control over the end result, and that is key to what we're doing here. You have control over the end result. So the brackets are now placed in the digital world through our very unique indirect bonding system. And this is a key to Smilefast which no one else offers. And once you're happy with it, you press the approve button. That's the pre-treatment position, and now we're looking at the post-treatment. And if you want any changes made, you just write your little comments here and press the revision, and it'll keep coming back to you until you're happy with the end result, and you press the approve button. And we go through each and every case a diagnostic criteria. And I'm not going to bore you with it tonight, but every case we assess in exactly the same way, so nothing is missed out on. So we go through all of these areas, and it looks a little bit daunting to you, but I promise you that within 6 hours of the course, you're going to go, this is so easy, it's not funny. And then we do the same with the treatment plan. Once we made the diagnosis, we decide on the treatment. And our first question is, are we going to treat or not treat? And then we go through all these other questions for each and every patient. And once again, it seems like it's a lot of information at the moment, but I can assure you it will be very straightforward, and it'll be actually boring for you by the time we finish our 2-day course. So these are the indirect bonding trays with the brackets already in the tray. So basically all you've done, and we teach you how to do this, is etch, bond, you put some composite on the base of the bracket, you hold the trays in, you peel off these bleaching trays, and voila, the braces are on the teeth. We show you how to put the wires in. And day one, so this is in January 2013. Then 1 month later, February 2013, you can see the teeth straightening up. 2 months, the teeth are straightening up. By month 3, which is pretty standard, the teeth are pretty straight. If you've got the brackets on correctly, you've made the correct diagnosis, then these wires that we put in, They straighten up and the teeth get straighter. Month 4, month 5, and all we're doing is tying these wires in, and after 6 months of treatment, do you think she looks better? She didn't have orthodontic surgery. She didn't have 2 teeth removed. She's a happy patient. She's referred me probably 30 patients by now. Yes, she's left with a bit of overjet, but most patients don't mind overjet provided the teeth aren't too proclined. If the teeth were proclined like this, different issue, but we make sure they're not. So these patients are very happy. So look at the difference before and after. Once again, what would you have done from a cosmetic point of view? From a restorative point of view, if you didn't have cosmetic orthodontics? Can you imagine how thick these veneers would be? Can you imagine how much tooth destruction on those canines? Would that be biologically and ethically the correct way to proceed? I don't think so. And you'll notice how every patient will be delivered with a bonded retainer, especially on the lower arch. And anyone can achieve these results. Anyone can achieve these results, honestly. So the question I get asked is, okay, Geoff, that's great, but I see other courses and stuff, and yeah, why is Smilefast superior to other systems? Well, firstly, it's the training. You're talking about comprehensive orthodontic training. I'm going to teach you sound orthodontic principles. I've been teaching internationally for different supply companies. I've been involved in enormous amount of teaching for general dentists, but the key is I'm going to teach you sound orthodontic principles. Our course is not a one-day course. It's a 2-day course to start off with. We also have 6 to 7 hours of pre-course videos. So there's a lot. You cannot learn orthodontics in one day and then expect to feel comfortable in treating patients. But I can show you and hold your hand throughout everything. We have a unique online web-based portal where we can help you with the treatment assessment. We will help you decide which patients are the ones to start, which ones aren't. But also throughout the entire treatment, we can help you with online support, visit by visit. We have a unique digital indirect bonding system, and that is key with regards to positioning those brackets. Our online support starts from treatment assessment to the final removal of braces, visit by visit. We also, if required, provide you with one-on-one support if you want us to visit your practice, or telephone support. That's all included. Sorry, the one-on-one support when we visit your practice is an extra cost, but everything else, telephone support, online support, is all included in our fee. And you can see our responses, and our online portal is second to none. This online portal allows easy case submission by the doctor, but we provide a total support system for your doctor, case by case, with the ability to download photos at each visit and ask any questions about the case. These will be answered by fully trained practitioners and fully overseen by our group of specialist orthodontists, ensuring doctors will learn very quickly and the skill level will be accelerated. We provide a total support system. And what's really interesting now is that Guild Insurance is charging extra if you are going to do orthodontics. That's just happened in the last few weeks. So don't you want to be with someone who will provide you with the best and total support? There is no software to be purchased, as our portal is accessible on any Windows-based computer. And I've showed you this previously. The key to orthodontic treatment is diagnosis, which cases to treat and which not to treat. Bracket placement, and through our digital indirect bonding software, we've got that nailed. We have got that nailed for you. And through our course, we're going to go through and teach you all that diagnosis, which cases to treat, which not to treat. And that's going to be followed up with our online portal, as I'm going to show you in a second. And then we've got to teach you some mechanics. And we'll do that all through the course. And once again, on an ongoing basis, we will cement that, reinforce that through our case questions as we go back and forwards discussing each particular case. Remember the 80-20 rule. We can treat 80% of the patients very easily. It's knowing which 20% not to treat. We're going to provide you with comprehensive orthodontic training, online case submission, and we have a treatment assessment. So you will bring in the patient. Sorry, you don't bring in the patient. You'll take photos of the patient, give me comments, and you will ask me to assess it. We'll approve cases, but we will reject them. Call us the John West. We reject patients if they don't fit into that low-lying fruit, because I don't want you to have any difficulties at all. So Smilefast will provide you with the only predictable digital indirect bonding system with local one-on-one support and sound orthodontic training. I can assure you it will be sound orthodontic training. We provide comprehensive orthodontic training for short-term orthodontics. What do we offer? Well, we offer a local Australian registered specialist orthodontist, me, who will be there for you. Online portal support from treatment assessment to final removal of braces. One-on-one support as required. Precise, predictable bracket placement using our unique patented digital indirect bonding system. Comprehensive orthodontic training for short-term orthodontics. And we're the only short-term system which discusses and utilises cephalometrics. And as far as I'm concerned, without this, you are indefensible. I'm not saying that you have to have it, but I'm saying if something happens to you and you don't have a lateral ceph and you don't understand the analysis, you are indefensible. So when you evaluate systems, what you need to look at is, does that system use intraoral or extraoral photographs? I know of some systems that have no photography. That's not Smilefast. You want to evaluate, does the system utilise cephalometrics to confirm the diagnosis or aid in the treatment planning? As I'm aware, we are the only system that does this. There are systems that do not have orthodontists to determine if the case is suitable. There are very few systems out there that has an orthodontist involved. And I think that's absolutely essential for your peace of mind and for good quality assessment and good quality training. You want to evaluate whether that system has ongoing support, and if so, is it provided by other dentists with minimal experience? Most systems have forums where people will just throw in their 2 bits worth, what I would call the blind leading the blind. We don't allow that to happen. A system that uses a technician or a person off the street to place the brackets with no idea of the eventual outcome. Just about every other system does this. They'll have a technician put the brackets on a model, provide you with the brackets in the tray, and you're saying to yourself, how do I know if the brackets were in the right position? You don't. You don't at all. I ask you the question, if you were doing a crown on a patient and you found a cheap lab that would give you the crown in a plastic bag, so there was no model, it wasn't even in the digital world, would you use that crown? Of course you wouldn't. But that's what you're doing with these other indirect bonding systems. You're allowing the technician, without you even be able to assess whether it fits or not, or whether if the bracket's in the correct position. Our bracket positioning is determined by the end result, and that is the key to a successful bracket placement. So when we look at the competitive advantages of Smilefast compared to a manual bracket bonding system, there's no digital setup with a manual system. It's not as accurate. Therefore, it's not as quick. There's no online portal. There's minimal support. And the per hour profit, therefore, is obviously greatly reduced. And with the area of litigation becoming more and more prominent, ask yourself these questions. If you get into an issue with APRA or your specialist orthodontist down the road, who will be there to defend you? Who would you like to defend you? Do you want to be a general dentist who's based in Singapore? A general dentist from the United States? Do you think they're going to fly out and help you? An orthodontist from England? It's your choice, but I think you should be going with a local specialist orthodontist who has a great reputation amongst his orthodontic colleagues, not for being a nice guy, because I don't have that reputation from my orthodontic colleagues, but I do from being a good clinician and knowing my stuff back to front. So Smilefast has been designed to ensure that you, the doctor, treats only those patients that will achieve consistent quality outcomes with minimal treatment times, minimal doctor chairside times, maximum profitability, and most importantly, no stress and totally happy patients. And we have plenty of dentists who've been on our Smilefast courses. You can see the testimonials on our website. Smilefast is the best system without any question, and this is a person who's done other short-term orthodontic courses. I just want to say what a fantastic system Smilefast is. You guys have been amazing in responding to questions. Smilefast is a first-rate orthodontic course offered by an experienced and knowledgeable orthodontist. Okay, we actually went out to this practice in Sydney to help him. Smilefast is a must-do for any dentist who wants to provide a high-quality cosmetic dentistry. The ongoing support provided by Smilefast is invaluable, with most clinical questions answered within the day, giving you the confidence in treating your patients, because you know that backing is only an email away or a phone call away. From the beginning of the treatment till the end, the Smilefast team have made every step so stress-free. Digital indirect bonding and 3D virtual setup, online case management, and continual education. You can't get any better than this. Thanks, Angie. So what we offer, initially we offer the Smilefast PRO, which is our 2-day course, which includes extensive hands-on training. Later down the track, we offer our Smilefast Advanced course after you've done at least 5 cases. So what do we go through in the 2-day program? We talk about what makes Smilefast the best performing short-term system, giving patients what they really want, correct diagnosis for different types of cases, which ones to treat, which not to. We talk about all the treatment steps, in-depth orthodontic training on orthodontic brackets, arch wires, and tooth movement, precise, predictable bracket placement with digital indirect bonding. We also talk about bracket placement with direct bonding. We talk about management of how we're going to manage crowded cases, spacing cases, deep overbites and rotations, which is about 80% of the orthodontic problems. We're going to master the tools and technologies of short-term orthodontics. We're going to provide you with an intensive hands-on training and individual doctor case discussion. So you're going to bring cases in, you're going to load them onto our portal, and we're going to discuss them as a team, the diagnosis and the treatment. We're going to show you the Smilefast online case management portal and our unique patent 3D viewer, support options, patient marketing, payment plans, in-depth troubleshooting. But what we do in addition to this is we provide you with pre-course training videos, which is more likely 7 hours. And in that we go through the course overview, how to make patients happy, the basics of occlusion, making the correct diagnosis, suitable patients for Smilefast, the perfect new patient exam, obtaining high-quality orthodontic records. So before you even come to the course, you will be able to take these records and have them there for a couple of your patients. So you can start your patients off as soon as you finish our 2-day live course. We're going to talk about how teeth move, the basics of orthodontic brackets, wires and ligation, the main orthodontic tooth movements, and we'll go through the viewer, basics of the viewer, the online portal. We'll talk about debanding and retention and ongoing case support. What we supply in this program, in our Smilefast Pro course, we have the 2 days course, obviously. We have the 6 to 7 hour online video, but we also provide you with full printed copy of all the lecture slides and hands-on course notes, hard copies of written materials, brochures, quick reference guide, before and after album, secure online web-based portal with a help desk which has hundreds of technique videos, clinical guides, protocols, downloadable form, website material. It's a massive information. Your marketing material for your practice and all materials required for the hands-on course. What's your investment? It's $2,800. And so apart from the 2-day Smilefast course, which is what, and most people only provide you with a one-day course. You're going to get these online videos, manuals, the before and after album, the resources. We also provide you with a typodont with porcelain brackets and a tooth-tone archwire, which retails at $600. And we're going to include your first case, which is a value of $1,299. Extra value in total of $3,949 for an investment of $2,800. That doesn't include the 2-day Smilefast course. And I can guarantee you, we've had people do many other courses, and they've learnt more out of our 2-day course. And I'm happy to give you a money-back guarantee. If you have not learnt more in the more cosmetic orthodontics in 2 days with me than any other person, I'll give you your money back. I have no issues with that. So our course dates, we're in Brisbane, Thursday and Friday the 28th and 29th of July 2016. We're in Auckland, New Zealand, Thursday and Friday the 25th and 26th of August, and Adelaide, Thursday and Friday the 20th and 21st of October. There are our course dates. If you go into the website, www.smilefast.com.au, we've got it for a limited time only, the $2,800 fee, and go into course sign up. And then later on, we have an advanced course. Later on, we have an advanced course for those who've done more than 5 cases. And we've got a big future in Smilefast. And honestly, I'm going to tell you, join the revolution. Because for some of you who may know something about orthodontics, there's a wonderful orthodontist called Rohit Sachdeva who invented copper nitinol wire, and he was also the inventor of SureSmile. And he's designing a patented new bracket system, very unique, and new orthodontic arch wires, which will be exclusive to the Smilefast approach. We're designing a new indirect bonding tray, which is going to be even more accurate and easier to place. And we're designing a new aligner system so we can finish off the orthodontic cases quicker, so we can get out of braces maybe a little bit quicker and just finish off with orthodontic aligners. So maybe we can finish the cases in 4 to 5 months and finish with aligners for another couple of months. So on that note, I want to say you've been a great audience. Thank you very much. Remember, it's only $2,800 for the course. That includes $3,949 worth of extra value, including one full case as well. And then as a bonus, you get the 2 days with me and Robin at the Smilefast PRO course. So these are the dates. If anybody would like to have more information, or for some reason you can't come to these dates, but you want to come to other dates next year, just email either myself, Geoff at smilefast.com.au, or Robin at smilefast.com.au. You could call Robin tomorrow on 1300 447 448. She'll answer any other questions that you might have. So at this stage, I would like to ask you to thank you for your time. I know it's been about an hour, which is what I expected. I hope you understand where cosmetic orthodontics is important for you in your practice, important for your patients, and how Smilefast is quite unique and can provide you with, I think, a lot of fun, a lot of profitability, and provide you with doing, I'm going to say, better and more ethical dentistry. So I hope that you enjoyed the webinar, and I'm open to answer any questions at this particular point. If anybody else has got a question, just please type it in for us. Is there a date in Melbourne? There are no dates in Melbourne for this year. We've already had a course in Melbourne previously, but we are looking at our course dates for next year, and obviously there will be a course in Melbourne. My advice is, if you're interested in future courses as well, if you give Robin an email at Robin, ROBYN, at smilefast.com.au, and just mention where you're interested in the dates, we'll put you onto our list, and we'll make sure that we notify you of the intended dates as soon as we have them. Do you have to pay? The question was, do you have to pay a monthly fee like fast braces? Not at all. There are no monthly fees. There's no ongoing fees. It's a fee case by case basis, and we charge $1,299 for a 2-arch case, that includes the digital indirect bonding. It includes the digital setup, the indirect bonding trays with brackets, arch wires, etc., as well as the ongoing support. If it's a 1-arch case, that's a fee of $900. There is no monthly fees at all. It's just a per case basis. And obviously, if you're doing volume in the future, there will be discounts and based on volume as well. We had a question, will that still be on special? I'm assuming that you're talking about the $2,800 fee. What I shall do for you is, if you email Robin now and with your interest, we will make, even if the price increases next year, I will maintain that fee for you. Any cost for, we had a question of any cost for rejected cases. A treatment assessment, which is basically where you put the case on the portal to ask me for advice as to whether we can treat it or not, there is no fee for treatment assessments whatsoever. So if that case is rejected, you don't pay anything at all. So that we had a question, when we do the course, do we need to bring a laptop to learn how to use the portal? Yes, we would like you to bring a laptop, because what we would like you to do is to actually load your first case or two onto the portal, and that way we can help you live at that point. Remember that you're going to have done the 6 hours of pre-course videos, so you're going to understand exactly the records that we need. But you just bring them to the course, and then we're going to help you load them on. The question was, how many CPD points? I think, if I'm not mistaken, we're looking at 23 hours of CPD points, because you've not only got the 16 hours of the 2-day Smilefast Pro course, but you've also got 7 hours of CPD points based on the pre-course videos that you'll also be watching. The question we've just had, will your talk be available on podcast for others who are not able to view tonight and view in their own time? Absolutely. We've recorded this webinar, and we can send a link to you hopefully tomorrow or Friday. So anyone who's interested in having a recording of it, or know of friends who would like a recording of this podcast webinar, once again, if you can email Robin at Robyn, at smilefast.com.au, and she will organise that for you. We've had a wonderful question. Are my questions answered online only, or can I speak with somebody? You have the option of either one. Yeah, and either myself, Robin, or one of our other orthodontic specialists will be happy to call you and talk you through it. We would prefer, though, obviously, to have your photographs of the case online, so we're in a position to be able to discuss it with you. But we can do whatever you prefer. If you're a verbal person that would like to speak to somebody, absolutely, we'll do that. If you'd like to have it done online so you can look at it at your own time, at the end of the day, we are there to help you and to make this work for you. Can we use Smilefast if we don't attend the course but have a background in orthodontics? Unfortunately, no. You have to be a Smilefast accredited practitioner to be able to use Smilefast, because I don't want Smilefast to be used in the wrong way. Now, having said that, if you've got experience in orthodontics and you just want a digital indirect bonding system, we have another system which we call PDIBS, which stands for Precise Digital Indirect Bonding Service, and we can provide your indirect bonding setups through PDIBS. However, we don't provide you with any support through PDIBS at all. We just provide you with a digital indirect bonding system. We don't provide you with any wires, etc. But we do provide you with an indirect bonding setup that you can view, and you can actually modify the brackets or the tooth position. But if you want to become a Smilefast accredited practitioner and use the name Smilefast and use the material that we provide, you have to do a Smilefast course. And we've had many people do the Smilefast course who have done other more involved courses, and each and every one of them, without exception, has said they've learned more in 2 days from myself in Smilefast than they've done in any other course, even with experience. And I'll put my reputation on that. We've just had a question. Does the system require me to have a digital scanner? No, not at all. If you've got one, that's fantastic. You can send the STL files to us directly, but we take PVS impressions that you would send to our lab, and we would pour them up ourselves, and we would scan them in as STL files. So you don't need a digital scanner at all, but personally, I would recommend digital scanners to you, as I think that's the future, and we talk about this extensively in our program as well. But to answer your question, you do not need digital scanners to submit cases to Smilefast. We've got a question here. What level of photography equipment is required? The level of equipment is actually very cheap. Any decent camera is fine. The key is the quality of the photography that's performed. Because for us to be able to give you proper advice, we need good photography. And we go through this in the pre-course video. We also go through this in the course itself. And we also have contacts of people that can come in and train you and your staff if so required. Because photography is a key. Good photography is a key for us to be able to support you properly. Do I have to buy materials and instruments from Smilefast? Absolutely not. You can buy all your materials and instruments from anywhere you want. The only thing that you need to buy from Smilefast is the indirect bonding per case, because that's what Smilefast is all based upon. But if you want pliers, etc., we can supply you with some of the instruments as a starter kit for those of you who don't have anything. For those of you who've got a lot of the equipment but just need a little bit extra, we supply you with the contact details of who we would recommend and what the codes are for the items, just to help you out. But no, you're not made to buy materials, etc., from us at Smilefast. Our business is to train you and to provide you with digital indirect bonding solutions and to provide you with a good support system. That's what we're focusing on. Would a hygienist or therapist be able to attend the course? Absolutely. We've had many hygienists and therapists attend the course, and the fee for the hygienist, if I'm not mistaken, I think it's about $1,200 for a hygienist or therapist to attend the course. And we will train them in exactly the same way we train a dentist, and they will do the hands-on component, etc. And in all honesty, our most successful practices are those that have brought their hygienist along with them, because they can delegate those procedures, which are mundane, but obviously essential to the final outcome. So we would love to have hygienists and therapists along the course. The turnaround time to receive an indirect bonding. At the moment, what we're suggesting is from the time that you submitted the case, you will receive the digital indirect bonding set up within 10 days at the most, and then another 10 days or so to receive the actual indirect bonding. So we suggest, at the moment we're saying 20 business days from the time you submit the case to the time you receive the indirect bonding with your Smilefast Arch Kit. Now that's based on the fact that you would review that case in a timely manner, because we've had some people who may sit there for 2 or 3 weeks and not review the case and approve it. Similar to the Invisalign system, you actually have to approve the case, and then we go into fabrication. And I just want to thank you very much for your time, and I hope that was of some use to you. Once again, if anybody wants to speak to Robin, they can do so, and I'll just give you her telephone number again. And her telephone number is 0433 555587. And she will be delighted to help you with any information, or email robin@smilefast.com.au, or you can email myself at Geoff, Geoff, at smilefast.com.au. Thank you for your time. I hope you all enjoy the State of Origin rugby tonight. And once again, thank you for listening to me, and I hope I wasn't too boring. Good night.